let's move on to protein. Protein and leucine is the next two that we want to maybe touch on. Protein, again, building block of muscle, and most people do need to supplement for a few reasons. Number one, you need the proteins to build the muscle, and the other part is to feel full when you eat, that you actually supplement with a little bit of protein and don't feel like you have to keep eating. So,
yeah, and the main thing is when we get older, from 50 above, we become a little bit anabolic resistant to protein. So you need higher dosages of protein just to maintain your muscle. I'm not even talking about building muscles, just to maintain your muscle, which is very different from a 20-year-old. So we're specifically looking at the 50-plus group now, and you'll need about 1.2 to 1.6 grams per kilo of protein a day to keep your muscle.
And just to touch on that, I mean, people need to realize that your stomach changes as you get older. So, I mean, things like vitamin B12 and all that gets absorbed differently. So protein the same. So I think we need to stress that people need to take extra protein, especially as they get older. And make sure that they have those numbers in their head, because it is quite difficult to get that numbers. I mean, if you think about an egg is about 8 grams of protein. So, and we just said that you need about 1 gram per kilogram of body weight at least. So if you weigh 80 kilograms, you need 10 eggs extra a day for supplementation. So that's a lot. You need to...
Yeah, and I think the reality then is that often we need to supplement. We've got options of supplementing protein. The most common one is a type of whey protein. But you also get essential amino acids that you can supplement with, and we can have a talk about that. The difference between the two. But I think with one thing that you need to keep in mind, when we say you need to increase your protein, we don't mean that you need to increase your calories. Okay, so it doesn't mean that you're eating more now. You need to increase your protein ratio in your diet. So it might mean that you need to cut down on some of the others. Otherwise, you're going to be in a position where you might gain weight in a way that you don't want to gain weight.
Yeah, so I want to move one step back again. So we said protein supplementation. So we can either do whey proteins, which is normally milk derived or from one of those products. You get the pea protein, which is for the vegetarians, comes from a plant source. And then obviously we talk about, you see on the little tubs where they say BCAAs or branched chain amino acids. Just for the science out there, scientists out there, the science of that is like amino acids are the building blocks of protein. So, and you need all those amino acids to build protein, but there are 9 of those essential amino acids, as they're called, that our body doesn't make itself. So you need to bring those in. And that's why sometimes it's good to take branched chain amino acids if you're not feeling like taking protein, because that is the building blocks that you're actually taking.
Yeah, so I think in the scenario that you might be on a vegan or vegetarian diet, you'll probably go for a pea protein type of thing, because to get it through your diet, it's going to be very difficult to get that amount of protein in your diet without increasing your calories. Okay. Something like the whey protein is very nice because you get that full sensation, so it does help a little bit with the hunger, but you can get some calories in with it, and that's where the essential amino acids is quite nice, because you don't get any calories with those. So if you want to up your protein without the calories, that's where you can use essential amino acids quite nicely. And you need to put it in perspective, like 5 grams of essential amino acids equals to about 20 grams of whey protein, just to put it in perspective, more or less.
Yeah, and all these things are so linked. I mean, if we think about to build a protein, what you need. I mean, we have had a whole podcast about iron. We haven't spoken about vitamin C yet. So all these things fit together to make both proteins, and then the other side that people always ask is collagen. So maybe we should touch on collagen and where it fits around a muscle and protein. So because we get asked, but should I supplement with collagen? So, and I think maybe we should go to the back a step and say, let's talk about the pyramid of the basics that you need to have. And if you don't have enough iron in your system, so especially here with the ladies again, we need to say we've had 2 podcasts about iron now. That is something we definitely can test for, and if it is a supplement you can buy over the counter, but you need to know what your levels are before you supplement. But up to 50% of women in the Western Cape are iron deficient. So if you have an iron deficiency and you take collagen, it's going to do very little to form the right collagen for yourself. So that proline to hydroxyproline will not happen if you do not have iron and vitamin C in that process. So
no, absolutely. So the collagen would mostly be the type 1 and 3 for tendons and cartilage. The type 2 is more for skin. So there's some studies that shows like that you do get some pain relief if you've got some arthritis type of condition like osteoarthritis from taking the collagen. And there's a couple of studies showing that it might increase some bone density if you take it with, which we'll have say something about that as well. But that can be part of your diet as well. You can include it in your diet depending on your goal again and where you lack. So you need to go see what exactly you need. It's not the umbrella type of thing that you'll do.